All right, today we are here with Susie Gronski, and we are both pelvic physical therapists, but Susie is particularly educated and specializes with men. And so she is the penis pelvic physical therapist. And, we'll get into it, but she has a book, she has so many great resources. And so in a world that often is considered women's health, which is, one piece of it, or I probably could, there's a spectrum, let's not even say it's half, that men often get ignored in this world. And women were ignored for a while. So the whole pelvis is ignored. So we are here to bring light, and especially for men who are dealing with pelvic issues. So Susie, why don't you kind of give me your background? How did the question we always get asked, why do you do this? Why are you, when did you decide, I wanted to be an astronaut and this, wasn't one of the choices when we were 12.
Right, right. I hear you. Yeah. So how did I get into working with people who have penises, right?
Yeah.
I do get that question asked a lot. And I did preface this off the air and say, it's really actually uneventful. I mean, I know folks, if in case you're all wondering, no, I do not have a penis myself. However, when I started my practice several years ago, my private practice, and got into pelvic health, it was very early on in my career of pelvic health that men were reaching out to me, asking me if I can help them with very similar issues that women were experiencing as well in their pelvic area and sexual health. And I said, well, yes, of course. I mean, let's do it. And I started to listen to their narratives, their stories, and how it took several years for folks to find me and do this work. And then I said, well, I started asking questions. Well, what would you have liked to see, or as far as a resource is, what's up? And they're like, no, there's like hardly anything out there on these topics, especially around sexual pain. And there's a lack of resources and spaces for men to feel comfortable. And then I said, well, that's not right. Let's do something about that. And so I really jumped on the opportunity to be an advocate for men and to bring more attention to men who have sexual pain or pelvic health concerns, and educating the community and also health professionals that, hey, 1 in every 6 men will experience pelvic pain at some point in their life. 1 in every 6.
It's a lot.
Yes, it is a lot. And it's probably more common than we think, because let's face it, it's probably underreported. A lot of things that people go through in their private areas that are different and change, we're not talking about it. So I found my passion in helping people with penises to really be their advocate and to help establish a voice for this very special group of people.
Well, yeah, and it's been an extremely helpful resource for men, people with penises, and professionals, for sure. So why do you think it is so challenging in our healthcare system for there to be proper resources, and why is it such a difficult journey?
Yeah, great question. What are the barriers to care for men reaching out, for health
I
professionals?
mean, we could go on for this question alone. You might. This could be a while.
100%. 100%. I 2 things that come to mind. One is knowledge with health professionals, their comfort level with asking sexual health questions or genital related questions on, an internist or, any doctor that they may see if they do see a professional. The other thing is that, men in general, and I don't mean to stereotype or, put everyone in the same category, but in general, the cisgender heterosexual men that I work with typically are very reluctant to seek care for sexual health concerns, because there is a social stigma around sexual health concerns, like pain, but also premature ejaculation, erectile difficulties. Where do you go? Who do you see? That's going to listen? to these concerns from a holistic perspective. And there's also this social script or construct around masculinity and what that means, and how individuals go about seeking care for their most intimate concerns. And in the literature, we know that folks want you to ask them about their sexual health. They want you to, they expect actually their health providers to ask them about sexual health. Healthcare providers, however, because this isn't in their wheelhouse and because there's an entrenchment of, again, deeply rooted social scripts and social cultural beliefs around sexual health being very taboo and stigma, it is not part of core curriculum in many health professionals training. And
Right.
so I'm not surprised that doctors are not asking questions around sexual health, especially for men. And then the third thing is that when men do seek care, they are often dismissed, not validated in their experiences, and the message that they often walk away with, well, we can't find anything on a scan,
Right.
nothing's wrong, it must be all in your head, or just deal with it.
Yeah.
Right. And that creates a huge level of mistrust with the medical community. And we know this from preliminary research that's coming out. Tom Astle and colleagues, they have done a survey, a qualitative study with men from all over the globe, really. And something that they didn't even ask, but in the comments was written, I don't trust that they can help me. I don't feel anyone is believing me. And that actually became, I believe it was the 6th, as far as like number 1 through number 10 top concerns or impacts that pelvic pain has on men. Number 6 is mistrust of the medical community, which the researchers are very surprised.
Well, and that isn't that part of the problem of the bias inherently in research and the medical system, and we see a lot of that happening right now. But really understanding that as a provider, there's so much we don't know, and so having those open-ended conversations of just saying, what are your concerns, and then helping, validating, and then just going based on that truth. This is an absolute.
Exactly. And there's many layers to this conversation,
Yeah.
because from an institutional perspective, one's training and knowledge, again, there might not be that time to sit with someone to get their full story. What is the statistic? 11 seconds before a health provider is going to interrupt you in your story. I think it's like 11 seconds.
Oh,
I mean,
I've never heard that one.
Yeah.
I mean, I figured I probably would have said minutes, but
yeah,
seconds?
11 seconds before they interrupt someone's story, explanation of what's going on for them. And then you have like 5 to 7 minutes if you're lucky with a health provider. And so are you really getting that person's full story from a humanistic, holistic perspective on their lived experience? No, absolutely.
And I think that's where we have that luxury. And that's where we can really figure out some of these whys and the origin of some of these dysfunction is because when when you hear a story long enough, the better you get at this, the story is, I don't know, 75% of it. Like you can,
that's right.
It's a huge aspect of it. So the story is extremely important, and hearing it, just letting that story out is really, really important.
That's right. And giving permission for that person to be vulnerable, which is not a message that is usually encouraged in mainstream social cultural ways.
Yeah, not at all. So, and the other thing I hear from men a lot too, that finally end up here or actually seeking help, finding somebody who can help, is anybody who they thought possibly could help was an OB or was an OBGYN. And that already they just felt really knocked down, that there wasn't even a specialty out there for this. I'm sure you hear that a lot.
Yes, absolutely. Like, again, for cisgender heterosexual folk that I work with, that can be very demasculinizing for that individual.
Yeah. what would you suggest when people reach out to you and they may not have access to you? How do you suggest them go about in their community? Do you have kind of here's the questions I would ask?
Yes, I do
Yeah.
actually. So, because I've recognized that all over the globe, there is this lack of attention and space for men to reach out for sexual health concerns and pain. I took it upon myself to expand my global network for sure. And it is challenging to find someone. And so when I just had this conversation right before we got on this recording with someone and saying, ask about, how comfortable are you working with men? What's your experience been? What's your treatment approach like? What should I expect? Because I educate folks on, hey, it's not always about internal work. And I know
Yeah.
other therapists might feel otherwise, but you don't have to do internal work to get better. And we really need to assess the sexual organs, which not every therapist is comfortable doing because it is just not within their comfort wheelhouse, which is fine. Again, I'm not here saying like y'all need to be looking at everyone's penis and testicles. But there are certain conditions that might be overlooked. For example, lichen sclerosis on the penis is a thing. And if
Mm.
we, and in this, and for example, one patient I had in particular has seen numerous health providers. And then I stepped in and said, this is sounding very similar and familiar when I assessed the penis and the glands. I said, I think we need another perspective here from a genital dermatologist who's very well versed in lichens for all genders. I think this is important. And
So
so,
you know one of them?
I
Like
do. I
I
do.
mean, I joke, but like these are hard specialties to find, but they're out
Yes,
there. They are
they
out
are
there.
out there. They
Yes.
are out there. And now, because everything is so digital, perhaps having an online
Right. That's a great
consultation,
concept. Yeah.
right, might be very accessible now, whereas before it wasn't. So, what a blessing that is, out of all of this
Right.
tragedy. There's a blessing in that, as hey, access to care might be more accessible than you think. I mean, folks can reach
That's a
out
good
to
point.
me and, again, connecting folks. So, asking those questions like, what do you do? What do you do if, what if I get an erection during a session? Because we are touching those
Yeah.
parts. There's nerves that
Yeah.
get genital
That's
stimulation. It doesn't mean that person's aroused. Just like
oh,
you can have an erection, wake up in the morning, but not be aroused. That's a natural
right.
physiological process. And if that person on the phone is very comfortable, it's like, oh, yeah, I deal with it all the time. Not a big deal. It's a physiological response. We're going to make sure that you're feeling comfortable. We don't have to do anything you don't want to do. Just
Yeah.
getting to know that person and how comfortable they are talking about sexual health and talking about erection, saying the words, that sort of thing. So those are the things I would look out for. Like, what's your approach? How comfortable are you treating with men? And maybe have you had any coursework
Right.
around men's health? And I know there's far and few between. I mean, I have a sexual pain course that I teach online now and in person. And I know Herman and Wallace has Holly Tanner has a course on men's
Yeah.
pelvic health. So there
No,
are some
there are
courses
definitely
out there.
courses. And there's,
Yeah.
there's coursework out there, and
Hmm.
it's an aspect of pelvic health.
Yeah. Yeah. So that's what I would
Well,
inquire
what about
about.
even medical providers? Um,
Mm,
but, we're talking therapists, but our medical community system rather is really kind of upside down, where this makes sense to us, right? Come to us first. We assess what we can help, what we can't. Oh, lichen, you have to, see this provider. Is it a prostate issue?
mhm,
Is it a nerve based? What other providers can help?
mhm.
But that's hard.
It is hard. And again, I think it takes some time for a practitioner to develop or build that network or web of support for someone and reaching out. Again, we need to do our own due diligence to reach out to folks. I mean, I do my best to try to at least work with that professional on a personal level if possible. Again, don't have a penis, so
Yeah.
going to a urologist might I can't do that. But connecting with folks who are of like mindset and understand pelvic pain or sexual pain greater or broader than just the prostate. Because
Oh, yeah.
again, prostate gets blamed a lot for these
Yeah.
folks. 97% of cases have nothing to do with a prostate infection or inflammation. Not saying the prostate isn't involved, because
Right.
all the structures of the pelvis are interconnected, interdependent, but the likelihood of having an infection is like less than 5%.
Yeah.
But the course of treatment, because we have a label prostatitis that's historically known to be treated with antibiotics, anti-inflammatories, Flomax, etc., that treatment can take years sometimes for some folks on that same merry-go-round before they actually say, I need to try a different approach because this isn't working. And being on antibiotics for that long or several courses is not healthy either.
Well, yeah, and I try to tell people, if it doesn't work, it doesn't work. That means next. That doesn't mean nothing's wrong with you. That doesn't mean it's not real. It means that is not the cause. And keep searching. Keep searching for,
right.
If your provider doesn't know what's wrong, check it off, move on.
Right, exactly. And that does mean being an educated consumer and advocate of your own health, right? Instead of putting all of that responsibility onto a health provider, because they're just resources, right? And they're human and make mistakes. They don't always get it right. And that's including me too. Don't always get it right 100% of the time, but being transparent and honest, saying like, hey, this is what I think is going on. And also knowing when to refer out.
Right.
When treatment and intervention and you've tried a couple things in your wheelhouse and it's not working, then it is our due diligence as health providers to say, who else can I connect this person with? Because they're not failing my treatment. What I'm able to provide is not working for them. So let's move on. Let's collaborate with other folks. And people really respect that.
Oh,
They
for
really
sure. I mean,
appreciate
if we could have that flip in the medical system, I think that trust, collaboration, communication would really, really increase. And I think as physical therapists, we are able to do that. And we've developed that. So I think that finding a physical therapist who's comfortable treating the issue that you are struggling with is out there and is really important. So you have a cool program for people that might not have a good resource in the area, right?
Yes, I have to say it's like co-treating with Dr. Susie.
Yeah.
Go at your own pace. So it's the men's pelvic pain relief program. Do it yourself, self-paced. It's 6 weeks right now, but of modules, but we are adding in several nutritional modules specific for chronic prostatitis, chronic pelvic pain syndrome in men. A nutritionist that is a resident currently in my practice is taking on that project, which I think is fabulous, and debunking a lot of stuff about supplements, which is a hot topic with pelvic pain, and mindful eating, and foods that fight pelvic pain and all sorts of things. So all that to say is that this program is expanding and always evolving and changing based on my knowledge wheelhouse as that grows, and as I have more collaborative partnerships with others. So that program, again, self-paced, it has a male urogenital model, a real person that we assess penis, scrotum, all the tissues we're talking about, and then some self-help treatment ideas. So it's not, again, it's general. It's not specific to any one individual or any one issue. It's pelvic pain, but it's so educational in the fact that you learn about your pelvic floor, you learn about function, and then you have some strategies that you can use, from movement snacks to reframing thoughts around pain. It's psychologically informed as well, and so it is a very comprehensive program.
Fantastic. And you have a book?
I have a book, Pelvic Pain: The Ultimate Cock Block. Yes.
Love it.
Yeah, thank you.
And so how is that different than your program?
They piggyback off of one another. I will say that the program, there's some changes to the book because it's the second edition. I have shifted away from certain traditional treatment modalities like trigger points and etc., which is we're not going to get into that on this conversation.
No, I'm with you on that.
Yeah.
I kind of cringe when that language is used,
but yeah. So
I
tender
get
tissues, tender tissues exist, but this second book is really double the amount of content, really trying to encompass the biological, the psychological, and the social, cultural, and interpersonal factors that are part of the lived pain experience for men, and it is psychologically informed, and then kind of debunks things around, stretching. What is it that's really happening, or what we think is happening? Trigger points. What's that all about? And then self-treatment as well. And so in a book format with lots of illustrations and getting to know your body and putting things into practice.
So you have so many great tools that are fantastic starts for, that are out there. And at the end, and I think, whatever your struggle and symptom, the education is so, so important. And just understanding what's happening, which is so much of a part of any pelvic issue. That's like, what is this weird area? And I say that because that's what's been given. That's the narrative that's been given to us. I always tell patients too, the head, shoulders, knees, and toes song started screwing it up for us a long time ago, like just the dissociation from this area. And honestly, mapping and bringing back awareness to this area so that you can start to understand what's happening, because that's the only way we can start to then rewire, control whatever is going on. But it is so important that education, because there isn't, medication can be supportive, but this is not a one hit wonder. There's not like an answer for, that's great when there's a really significant pain relief, fantastic, but it's usually a journey to heal, because it was a journey to get there.
Right. 100%. Good points. All good points. And also just bringing hope back on the table for folks, because your body is always changing, and from that biological, physiological perspective, your pain can change as well. So it is hard. Pain is hard, but it's also hopeful.
So hopeful.
See,
it's actually, you have the ability to regenerate and rewire, and that's the fantastic aspect of it, is like, this doesn't have to be what you suffer with.
Right. Exactly.
So that's fantastic. That's all sound. I love resources. I love education, because building trust, and for you to find a pelvic therapist that you click with, that listens to you, it starts with patients advocating for themselves and understanding, and that will be the best journey if that can start early. So anything else? What I'm sure you have a bunch of other tricks up your sleeve. What else? You got a book, you got a program.
I got a YouTube channel. Right? Yeah, you can see me. I have plenty of people who visit and travel even now.
Where do you live in?
I'm in Asheville, North Carolina.
Such a cool place too. I've been meaning to get down there.
Yes, it's a fun place to visit. Small town, but lots to do, especially outdoor space, which is a commodity these days.
Yeah.
And yeah, so Asheville, North Carolina. Again, you can connect via online as far as doing sessions. YouTube. I'm mostly transitioning there as far as being able to get resources around sexual health and pelvic pain for men specifically. So YouTube and my newsletter. So my newsletter is another way to stay connected, to get resources for free, worksheets, other videos. Those are the main areas to connect and stay connected.
Sounds great. So the message here is, if you have a problem in your penis, it does not have to remain a problem. And there are many practitioners, although a little challenging to find, we're out here, and there's so many resources for you to become, the person who you are.
Yep, 100%. Such a positive message to end on. I love it.
Right? All right. Well, thank you so much. And I will have all of these notes and all these resources, in the links, and, all the places you can find them, so that anybody that has a question can find it quicker. so that they can feel better quicker.
That's right.
Thank you.
Thanks so much for watching that video. Please hit the subscribe button if you'd like to see more of those videos and keep learning on how to read your body.